Back. Dr. David Benton, CEO of the National Council of State Boards of Nursing, is on Guam visiting, and tomorrow he'll be addressing the Guam Board of Nurse Examiners with the presentation, Working Together to Protect the Public. Welcome.
Thank you very much.
All right, so first off, welcome to Guam.
Thank you.
First time we were talking earlier for you to visit the territory. What was going through your mind whenever you received the call to come and be a part of this?
Well, I thought it was a great opportunity to meet with people to talk through how the Guam board can be really part of a much bigger community. They're very active within the National Council of State Boards of Nursing, but living here so far away, it's sometimes difficult to connect and to move things forward.
Yeah, and so when it comes to your presentation tomorrow with all the participants, what are you going to present to them?
Well, there's really two parts to the presentation. One is looking at the changes that are taking place within regulation at the moment, how we can better protect the public in what is a very different world, a world where complexity, the changing health needs of the population are very different. And the board has to shift with those demands as well to make sure that we protect the public, but we also make sure that practice is contemporary and able to deliver on those needs. The second part is about something called the Licensure Compact. And this provides an opportunity for people that are stationed here to use their license in a very different way. It helps with mobility and it helps increase access to services through their availability in the labour market. Yeah,
and so earlier we were talking a little bit more about that and how the legislation is still pending approval to move forward, but then we were trying to comparing that with military families and how they're constantly on the move. Can you explain a little bit more about how that will be a benefit for them?
Sure. Well, obviously, as families move around, if a spouse is a nurse or a health worker, they have to license in the state within which they are wishing to practice. That can be a bureaucratic process. It can take time.
Right.
And the last thing you want to do is to be sitting there with skills and not being able to use them. So this is a mechanism where if you have a license in one state, you have the privilege to practice in all other states that have passed the legislation. So it really opens up the potential for particularly military families, but also for those that are moving for experience, for education, and other forms of opportunity.
Wow. And would you say that this has been kind of a discussion or a challenge, difficulty for you all to get to this point?
I would say yes, because first of all, people don't understand the concept. How can you have legislation that enables this to happen? So we have to work with legislators to explain how it actually works.
Right.
We have to get all of the groups on board as part of the process, making sure that education understands, that service understands, that military families understands the benefits of this. And if we all work together in moving this forward, then it's usually quite a smooth path to pass the legislation.
Okay. Tell us a little bit more about your presentation tomorrow, the conference tomorrow at...
Sure. So tomorrow we're going to be looking at some of the real challenges. So for example, we're seeing very different health needs. We're seeing chronic diseases that are really problematic to this generation, and that will require nurses to have different skills. We're also looking at some of the issues in terms of technology, the fact that we're using technology in very different ways. We can offer advice over the telephone at a distance. We can control infusion pumps at a distance now. All of these things have regulatory challenges, which I'm excited to talk with the nurse leadership about how we can address those together. We can learn from each other, we can learn from the experiences of others, and it's important that we listen very carefully to folks here in the territory, because they will have different challenges that we need to address as part of that process.
For sure. While you're there mostly to educate and share and with those that are working here, are you hoping to take anything away from just the visit and meeting the people?
Absolutely. Every time I visit a board of nursing, I learn something.
Yeah.
The fact that the multicultural nature of Guam, the fact that you've got such a long and dynamic history, all of these things give new nuances to some of the issues that we face. So whether it is infectious diseases or chronic diseases, or how do you provide services in an environment when typhoons and other natural disasters come your way, because again, the compact can help there. It can facilitate the delivery of care in times of disaster.
All right, Dr. Benton, anything else that you'd like to add just about your visit here on Guam?
I think it's a real opportunity for us to learn from each other. I'm looking forward to meeting with nursing colleagues from Guam, and I'm sure I will learn as much from them as hopefully they will learn from me.
Definitely, and hopefully we can get that compact moving forward soon.
Absolutely,
All right.
absolutely.
All right, enjoy your time here. Welcome to Guam, and good luck tomorrow.
Thank you very much.
All right, thank you so much. Keep it